Good morning and welcome back to Security Health Plan Academy, our monthly webinar series designed to provide Medicare Advantage plan members with information relevant to their health, wellness, and healthcare plan. Today's presentation will cover the basics of our Medicare Advantage plans, including how to find in-network providers and how to make the most of your wellness and preventive care benefits. You'll also learn about exclusive discounts, special perks, and valuable resources available to you as a member. Here to lead the discussion today is Sarah Selinsky, Senior Agent Manager at Security Health Plan. She has been a dedicated member of our team for 25 years and played a key role in launching our Medicare Advantage plans, originally known as Medicare Plus Choice. Sarah and her husband Craig have one daughter who is currently studying English and creative writing at the University of Iowa. Fun fact, their daughter is also a published children's book author. In her free time, Sarah enjoys cooking and gardening. All right, with that introduction, I think, Sarah, the floor is now yours. Let's dive in.
All right, perfect. Thank you, Ashley, and thank you for that introduction. Thank you, everyone, for taking time to join me today to talk about some of our value-added benefits. So like Ashley said, the purpose of today's webinar is to really make sure that you're getting or taking full advantage or maximizing your benefits with Security Health Plan. So one of the things that we want to talk about is how to find a provider that you can use with your health plan. So a Security Health Plan is an HMO or a health maintenance organization, which typically means that you are having a set network of providers that you need to use for your healthcare needs. Security Health Plan is an HMO. However, we have a very broad network of providers that you can choose from. You'll notice that we have over 10,000 hospitals, medical facilities, providers, and specialty providers that you can use within our system. So up on the screen, you'll see that there are a number of larger providers, but that doesn't mean that those are the only providers that you can see. So some of the bigger ones are going to be Marshall Clinic Health System, Aspirus, Mayo, UW Health, St. Luke's or Essentia, some of those bigger players. Again, that's not the only providers that you can use. So if you're not seeing your provider up there, don't be alarmed. We do have an online provider directory listed at the bottom there for you, or you can also call customer service to see if your provider is an in-network provider. Also with Security Health Plan's Medicare Advantage plan, not only are we an HMO or that health maintenance organization, we also have a point of service built right into our plan at no extra cost. This gives you the freedom to choose any provider that you would like, as long as that provider is Medicare certified and has not opted out of Medicare. So a good majority of the providers in the United States are Medicare certified. If they are certified, have not opted out of Medicare, and willing to bill Security Health Plan, you are fine to use them, whether they are in-network or out of network. That's a great feature that we offer here at Security Health Plan that not many other carriers do. The other feature that's really great about Security Health Plan is if you do go out of network, the copay will be exactly the same as what it would be if you were using an in-network provider or someone right here in central Wisconsin. So same max out of pocket, same copay, great benefit when it comes to the provider network. We also offer worldwide urgent and emergent care services. So again, if you are snowbirding or you're on vacation and something happens, don't get alarmed. You can use any provider. Again, urgent or emergent care services are covered worldwide. Again, the health and wellness here at Security Health Plan, we understand that that's very important. So we do offer an over-the-counter benefit. With this one, it is a $30 quarterly credit that each subscriber receives. So if husband and wife both have the plan, you both get the $30 quarterly credit. And they are meant to purchase items through our catalog that can be done either by phone or online. And those items get mailed directly to your home via FedEx 2-day priority shipping. One thing I want to note is that members of our Medicare Advantage plan get $30. However, members of our Medicare Advantage dual eligible or ALI or X plan get $80. So if you're noticing a difference that you're receiving, that's the reason. But again, these are items that you can pick from the catalog. Like I said, there's about 200 different items, including bandages, pain relievers, vitamins, sunscreen, toothbrushes, toothpaste, blood pressure cuffs, things like that. So definitely take advantage of those items. We also offer a gym membership or a fitness program. We recently changed from Silver Sneakers over to One Pass. One Pass is an annual gym membership that is offered to you at no extra cost. Security Health Plan takes care of that for you. It does give you access to about 19,000 gyms located in the United States, including the YMCAs. It also gives you access to about 25,000 online and live streamed fitness classes that you can do at the comfort of your home. There are specific programs that are designed for members with disabilities and also to improve brain health. So again, if you are someone that likes to go to the gym or walking or swimming in the winter, great opportunity for you to take advantage of this program at no cost to you. You do need to call and register with OnePass. You can either call or use the link listed there for you at the bottom. OnePass has also added a new program called Bold. This is a personalized exercise program. They are run by expert coaches or trainers, and they are also live and on-demand classes such as strength and balance, yoga, and Tai Chi. Those expert coaches or trainers are meant to make sure that there is a convenient format for the program, and also to make sure that each member that's participating is doing the moves correctly and safely so that you don't get hurt while you're doing those. So again, please take advantage of the One Pass and the Bold program for those exercise needs. We also offer some health coaching. This is one of my favorite ones. So if you are someone that needs help with either weight management, tobacco cessation or quitting tobacco, trying to introduce a little bit more physical activity in your daily routine, we do have health coaches at Security Health Plan that will be more than happy to do that. It is a program that is done via the phone. So if you can take a few minutes out of your day to have a coach call you and walk you through some steps, the phone number is listed there for you. You can call customer service. That number is the same number that's going to be on the back of your ID card as well. We also offer some additional perks to our members. This is by far where we're going to spend the majority of the time. So we do offer free preventive health services, which include preventive colonoscopies, mammograms, and bone mass measurements, and then also some select vaccines as well. We also have a convenient mail order pharmacy. So if you are taking a number of prescriptions and you're kind of tired of running to the pharmacy to pick those up, we do have an option for you. It's called Birdie. So you can just call customer service and we'll send you the forms to be able to get that started for you. We also have Care My Way. This is a nurse line where you're talking to a nurse practitioner for common ailments. So maybe you think you have pink eye and you're not really sure if you should go in or not. If you call this number, you'll be connected with a nurse practitioner and they'll ask you a couple of common questions, some of your symptoms. And if it's something that they can prescribe over the phone, they'll go ahead and do that. If it's not something that they can prescribe over the phone, or maybe it's something a little bit bigger than what they can handle over the phone, they will ask you to go to your locally urgent or emergency room if that was required. We also have RX Saving Solutions. This is a fairly new program to Security Health Plan. This is meant for members that have prescription drug coverage with Security Health Plan, and you have to opt into this program, so you don't automatically get thrown into this. But this one is really nice. When this one first came out, I actually enrolled in it so I could see what everyone else was going to receive, and this one is great. Some of the things that members will see once they've opted into the program are things like if a different pharmacy is charging less or is less expensive on a medication that you're currently taking, you'll get that notification. You'll also be notified if a different format of the same medication that you're taking is less expensive. So maybe you're taking a capsule, but maybe the tablet is less expensive. You'll see that. And then you'll also see things like if a completely different medication than what you're taking that does the same thing is less expensive, you'll see that as well. I personally, when I enrolled in this one, I was using an eye drop, and an eye drop came through that it was going to be, another option was $134 less expensive per month. So of course I jumped on it. It does give you, if you're using the mobile app, it does give you the option to email your provider. So of course I emailed her. Fortunately for me, she's a really good friend of mine, so I was actually just trying it out. She came back to me within a day or two and said, yes, this is a good option. However, if you decide to take that prescription, you're going to need to use this eye drop 6 more times per day. For me, I wasn't willing to do that, so I was just going to stay with my current one. But if I wanted to change to that new prescription, your provider can just send off that prescription to the pharmacy on your behalf and you'll be on your way. So a great savings opportunity for prescriptions on that side. We also offer professional help with staying healthy. With this one, this is kind of a 3-part program. We have disease management, care management, and the nurse navigators. So on the disease management side of things, we have when you go in for a service and there's a claim, let's say you're diagnosed with high cholesterol. As soon as that claim hits our system and we see that high cholesterol diagnosis, you'll start getting some targeted mailers specifically around that condition. It could be a mailer on, how to introduce exercise into your daily routine to bring those numbers down, or healthy eating habits of, kind of bringing those things down. So targeted mailers are one thing, and there's also some interaction with the care management team as well. On the care management side of things, this is by far one of my most favorite programs that we offer. And until you really need to use it, you're not going to understand how valuable this is to members. The care management piece is really meant to help people coordinate the care and getting the appropriate care at the right time. And what that means, personal story for myself, last fall I was diagnosed with colon cancer, and I was using a local facility here, but I was also using a facility at UW Health. My providers here transferred my case to UW because that was my choice. The care management team came in and helped me make sure I was seeing all of those specialty providers in the right order to making sure that I was getting the appropriate care at the right time. They can also help with getting prior authorizations completed. So really, the nurse case management team came in, they made sure all of my prior authorizations were approved. I knew exactly what my copays were going to be before I was seen. I really just needed to show up for my appointments. So huge shout out to our care management team. If you're someone like me that needs a little bit of extra help trying to figure out who you need to see and in what order, or using multiple facilities, the care management team and the nurse navigators are excellent. On the nurse navigator side, again, they're really meant to help coordinate that care in between multiple facilities and multiple specialty providers. They also can explain how your health insurance works along with your health benefits. So how things are covered, what copays would be associated with things, and so forth. So again, if you need that additional assistance, you just need to ask for the help. You can call the number that's on the back of your ID card. The next program I want to talk about is OMADA. OMADA is a online self-paced program that is meant for people that are diabetic, pre-diabetic, or need help with weight management. If you do not have a computer and you want to join this program, let us know and we'll help you get there. We've had people that don't have access to a computer that we set them up at a local library. So don't feel that this isn't something that you can take advantage of if you would like to. We can certainly make it work. So the OMADA program is not meant to take the place of any doctor visits. It's really meant to help in between appointments, some coaching done in between appointments. So people that register and join this program will get a free meter to test your blood sugars, and they'll also get a smart scale. The smart scale is connected to OMADA. So as soon as you step on that scale, OMADA knows the readings, and that's where the health coaching comes into play. Again, completely online, self-paced. You can do it very quickly or you can do it slowly, however you would like. The Free Spirit program is very similar. This is also an online program meant for mental health. Again, if you don't have access to a computer, let us know. We will help you get there. This program is designed for people to log in 2 times per day for 17 minutes each time. And it's really meant as a breathing exercise. But this program is designed to eliminate or reduce symptoms for panic attacks, stress disorders, and PTSD within those 28 days. And I can tell you that we have had really good success with this program. So again, if you are that person that needs a little bit of extra help in this area, all you need to do is call and get enrolled in the program. The last one there is Adhere Health. This is fairly new to the health plan as well. This one is meant to give a little bit of extra assistance in finding community resources. So if you need that help as well, please reach out to us. All right, we also offer a vision benefit. So at no extra cost, we cover one eye exam each calendar year at 100%. So it doesn't matter if this is a preventive visit or a problem visit, we cover it at 100%. You can use an in or out of network provider. Again, as long as that provider accepts Medicare, you are completely fine. If you want to take advantage of the eyeglass allowance, you do need to purchase your glasses from an in-network provider. We do have the provider directory link listed at the bottom for you. You can either check that out on your own, or you can also call customer service. We'll be more than happy to see if the provider that you're looking at is considered an in-network provider. All of the plans, with the exception of the Esteem RX plan, get $175 towards the purchase of glasses every calendar year. The Esteem RX plan, you can get $235 towards the purchase of glasses. With this benefit, I do encourage you to ask your provider if any other discounts apply. There are some providers that give very big discounts above and beyond what we are offering here at Security Health Plan. We also offer a hearing benefit. So just like the eye exam, you can use any provider that you would like, whether it's in or out of network, as long as they accept Medicare. This one, however, is considered a specialty provider, so there will be an office visit copay associated with this. So depending on which plan you have, it will either be $25 or $50 that you would be responsible for on this benefit. If you want to take advantage of the hearing aid benefit, you do need to purchase those hearing aids from an in-network provider. You would get 2 hearing aids per year at a $500 copay each, and that also includes the fitting of the hearing aids. That is a huge benefit, considering that hearing aids range anywhere from $3,000 to $6,000 if you pay for them out of your own pocket. We also offer a dental benefit. So all of our plans, with the exception of the Esteem RX, I'm going to go through all of the plans except Esteem RX first. So all of the plans will get 1 cleaning and 1 exam each calendar year. You do need to use a Delta Dental Medicare Advantage provider. That's very important. If it's not a Delta Dental Medicare Advantage provider, you do not get this benefit. So with this benefit, you get 1 cleaning and 1 exam. You also get 1 set of x-rays each calendar year. And every 5th year, you get the full mouth or panoramic x-ray. Those are covered at no cost to you, again, as long as you are using a Delta Dental Medicare Advantage provider. The Esteem RX plan, our 0 premium plan with prescription drug coverage, this year for 2025 has an enhanced dental benefit. You actually get 2 exams, 2 cleanings, 1 x-ray, and then that 5th x-ray or 5th year, you get the full mouth or panoramic. You also get some comprehensive benefits. So for emergency pain treatment or fluoride treatment, you would be responsible for 20%. And then restorative services like fillings, crowns, root canals, dentures, things like that, you would be responsible for 50%, up to a maximum of $1,000 in benefits. So again, another great benefit with both of those plans, whether it's the enhanced plan or the one that's up on the screen, it does need to be a Delta Dental Medicare Advantage provider. Again, the online provider directory is listed on the screen there for you. Again, you are more than welcome to call customer service or Delta Dental directly to find who is in network. We also offer some additional perks with your Medicare Advantage plan. So we do have competitive premiums. Our premiums are not cookie cutter. We have plans that start at a 0 premium and increase all the way to that $250 mark. So it's really a plan you can choose that fits your needs and budget. We do offer award-winning local customer service. So if you've had an opportunity to call customer service, I'm sure you'll agree with me that our service is top-notch. You always talk to a live person located right here in Central Wisconsin. We do our very best to provide the very best customer service and first call resolution. We have that large or broad provider network. So again, we have that in-network, and then also the freedom to choose the providers out of network and the urgent and emergent care worldwide. Primary care visits are covered at no copay. So regardless of which plan you have on our Medicare Advantage space, primary care will have no copay associated with it. And then we do offer those extra value-added benefits that we talked a little bit about. So the vision, hearing, dental, the over-the-counter benefits, and then the gym membership. And then we also have our pharmacy services that we're going to talk a little bit next on our next slide. Our pharmacy services, if you have specific questions, I would ask you to call their customer service line that's listed there for you. You can also call the regular customer service number that's on the back of your card and ask for pharmacy services. That is an option as well. But they're really there to answer any questions as far as prescriptions are concerned. What your copays would be, how close you are to getting your $2,000 max out of pocket. They can help with prior authorizations. They also have a new program called the medication synchronization. So if you're someone that is taking multiple prescriptions and it seems like you're going to the pharmacy all the time to pick up those meds, we do have a program to synchronize all of those medications to be filled on the same day. So it may take 1 month to get them all filled on the same date, but that is a great program that our pharmacy services would be more than happy to talk to you about to get those medications filled all in the same day. We also have a new feature on our website called Find Help. This is a resource that connects you with resources in your community at a discount. So if you are looking for furthering your education, or you need financial assistance or housing, please check out our website. The link is listed there for you to get connected with those additional resources. We also have a mobile app. So I know a lot of you don't have your cameras on, but if you can do a show of hands, there is a feature that you can raise your hand. Just a show of hands, how many people are using our mobile app? This mobile app is a great feature and allows you to manage your health 24/7. Things that you can do on the mobile app are things like checking your deductible, how close you are to your deductible. You can do live chats with customer service. You can track your claims. You can find providers, whether they're in or out of network. You can start a Care My Way call, things like that. This is meant for a paperless communication as well. So if you would rather look at your explanation of benefits or personal health statements on your phone or app versus getting them in the mail, that's a great option for you to use as well. So I'm going to stop there. I know that was a lot of information in a very short amount of time. So we may have time for just a couple of questions. But again, thank you so much for your time this morning. I appreciate it. I appreciate you taking time to spend the morning with myself. And if we don't have any questions, I hope everybody has a great afternoon.